Welcome to Module 5. In this presentation, we will be discussing basic concepts on nutrition research. But before we start, let's do a quick overview on Module 5. So Module 5 is divided in two main areas, nutritional research and basic methodology. In the first part of this module, we will be discussing basic concepts of nutritional epidemiology. We will talk about the considerations that must be taken into account when we analyze nutritional data, and we will talk about the newest directions in nutrition research. In the second part of this module, we will learn basic methodology, including how to identify the research aims and develop hypotheses, what are the different types of research methodology in nutrition research, how to conduct literature reviews, and finally, how to develop research manuscripts and peer reviews. So let's start by talking about basic concepts on nutritional research. We know that nutrition is a complex concept that is linked to behavioral, environmental, social, and biological factors. And these factors determine food intake or diet, nutritional status, quality of life, and even the health status of individuals. So human nutrition can be affected by the behavior and preferences of the individual, its socioeconomic status, the cultural and social factors that surrounded him, the food accessibility and availability, the environment, and even the mental and physical functioning. And all of these factors will determine the quality of diet, the nutritional status of the individual, and even the quality of life and health. And when we think about the individual's nutritional needs and even their habits and preferences, we need to consider other factors such as age, gender, physical activity, and health status. As the nutritional needs and the nutritional patterns changes, let's say, for example, from childhood to elderly or from a healthy individual to someone with cancer. Now, when we think about deficit or excess of essential nutrients during various stages of life, we need to think that these are related to the appearance of short and long-term effects in human health. So let's take, for example, breastfeeding. From a short-term perspective, breastfeeding reduces morbidity and mortality on children from poor living conditions and in preterm infants. But from a long-term perspective, we know that breastfeeding is associated with better cognitive development, but also has a protective effect on obesity, a prevalence of type 2 diabetes, and even on lowering the effect of blood pressure. So when we think about these short and long-term effects of nutrition and human health, then we should think about nutrition as this continuous factor that affects our health throughout our life. And this is from preconception to our elderly stages. So the graph that you have in front of you is just telling us a few of the main areas where nutrition is fundamental in each of the stages of our life. During preconception, nutrition has a fundamental role in fertility and also in genetic changes and late life genetic expression. During fetal development and growth, maternal determinants such as metabolic and nutritional changes in the mother, as well as deficiencies that could affect the fetus, the placental function, let's talk about oxygen and glucose uptake for optimal function, and even the nutritional needs throughout gestation, such as higher demands during the development of the central nervous systems, are some of the areas where nutrition is essential. During infancy, breastfeeding and weaning, along with food preference and food habits development, are three of the main areas where nutrition has an important role, parallel with height and weight gained, and also with nutrient deficiencies and other nutritional problems. In this stage of life is also where we start seeing some of the allergies where nutritional immunology is fundamental. Now, in childhood and adolescence, we keep up with height and weight gained, as well as other nutritional deficiencies and problems that can be carried on from in infancy. But also, we can see the early development of some habits and even the onset of some diseases that can become chronic. And finally, during adulthood and aging, nutrition becomes very important in the reduction and modification of risk factors to prevent diseases. It's also important to modify habits to treat diseases and to adopt healthy behaviors to reduce the burden of diseases. Now, the main aim of quality nutrition is to promote a good quality of life. Nonetheless, there are harmful effects of poor nutrition, such as poor development and growth in infants, children, and adolescents. Uh, there is an introduced risk of a higher prevalence of chronic diseases such as obesity, cardiovascular diseases, diabetes mellitus, and cancer. There is also a higher risk of illness severity, slower recovery, and compromised immune system, a higher risk of disability and death. There could be neurocognitive deficits such as attention, memory, focus, and even sleep. And then from a populational standpoint, and even an individual one, there can be economic and social effects. Therefore, we must support treatments, interventions, and even political decision making with scientific evidence. Now, why is it that nutrition research is so important and we need to do it? Well, the main reason is that nutrition research provides critical science-based evidence on the role of nutrition in human health and disease through the identification and addressing gaps in nutrition knowledge and its relationship with human health and disease. It also creates a bridge between researchers and practitioners, such as nutritionists, physicians, and nurses, that can provide the best clinical practices and treatments for individuals and even the population. And it also provides greater assurance of accurate and valid results through peer review. But finally, and from a populational standpoint, it provides critical and compelling evidence for decision making and policies, which is the ultimate goal to improve the population's health and human society. Now let's look at it from a different angle with a health impact pyramid. When we're thinking about an individual level, we're thinking about giving education and counseling as we do in the clinical practice. And as we move further to the base of the pyramid, we start considering more of a populational impact through clinical interventions, public health interventions, and then policy and lawmaking. But the whole point about having evidence in nutrition and having scientific objective measurements is to actually change the social and environmental determinants of health that could account and could potentially affect the population's health. From an economic and social perspective, nutrition research provides the evidence and knowledge to reduce the costs in treatment and hospitalization due to chronic diseases, as most of these diseases are related to modifiable factors that are linked to nutrition. And we can also promote healthy habits that can delay or avoid the appearance of worst outcomes. It can reduce morbidity and mortality in the populations. It can increase work productivity and efficiencies in industry and workplaces, as well as a reduction in the number of sick days. It also improves food security by enhancing education and food access and availability, especially through private investment and marketing on small farmers and on healthy foods. And it can also transform the traditional agricultural and farming sectors into more sustainable economies. From a regional perspective, there are some nutritional priorities that have been done in the past and should continue, and others that are worth mentioning and studying to improve the population's health. Some of these priorities include chronic malnutrition, especially in infants and children with stunting, wasting, underweight, overweight, and obesity. Then maternal and child health, especially with breastfeeding and maternal deficiencies. Also micronutrient deficiencies throughout the lifespan that sometimes it's overshadowed. Food security, especially in rural areas. And then sustainable agriculture, which can improve not just the health status, but also the economic status of the country, as well as the study of chronic diseases that, even though currently have low prevalences, are on the rise, especially with cardiovascular and metabolic diseases. And finally, the sanitary environment, especially when we're talking about preventing waterborne and other infectious diseases. Now, we must acknowledge that there are major limitations that could prevent research not just in Laos but in many other countries, especially due to the lack of resources. Some of these limitations include the limited funding or the lack of structures to administer funds. There are limited access to literature and existing evidence, especially due to the cost of databases. There might be gaps between academia and policy developers, and even with the population, as anecdotal evidence sometimes have a higher power over scientific evidence. And then from an organizational and structural standpoint, there might be a lack of collaborative efforts between agencies, both within and between institutions, which can either just like replicate the same studies or just can prevent the studies to result correctly. And even though we just discussed the limitations on doing research, we can always improve nutrition research through a series of considerations. First, there are a series of research practices, such as peer review groups and work balanced, especially on the PIs, that should be placed in all research groups. Also, time should be designated for research, especially from an organizational or an institute standpoint. There should be incentives to conduct research and to publish. Researchers should go through continuous education to learn new methodologies and to be updated. And these educations should consider time, language barriers, and exposure to research. Also, we should account for cultural factors, attitudes, and beliefs, not just in our research, but also in the education that we're given to the researchers. And finally, we should incentivize collaborative efforts with national and international organizations. All right, so far we have discussed why nutrition is relevant in our health and why nutrition research is important from an individual and a populational standpoint and from a scientific and an economic standpoint. But now let's try to bring and combine everything together, and I'll introduce an area of science which is called nutritional epidemiology. So let's start by defining it. Nutritional epidemiology studies the effect of diet on populations' health over the life course. It aims to assess how our diet intake and the patterns are associated with the risk of diseases, but it also considers how complex our diets are and how these interact with other potential factors such as our genes, our physical activity, our behavior, and even some of the socioeconomic factors. Nutritional research and nutritional epidemiology is supported and interacts with multiple disciplines, which includes biochemistry, cell culture studies, animal studies, and physiological studies. But the main characteristics is that it approaches nutrition from an epidemiological and biostatistic standpoint. And it also considers the research question as the main factor to decide which is the methodological approach that we need. The nutrients of interest, the population of study, and even what's the available information that we have. In nutritional epidemiology, we look at those factors that affect our nutrition, our diet, and our health. And between these factors, we need to account for our diets or our dietary intake. Now, why do we need to conduct or why do we need to look at this? Is because first, this helps us understand what is the usual intake of a population. It also helps us assess the nutrient adequacy or if there are any deficiencies in that population. And it kind of helps us examine the association between nutrients or foods or diets and diseases or behaviors. However, one of the main limitations is that diets varied within and between individuals. So basically, we don't eat the same thing every day in not 3 years, and we don't eat the same thing as the same foods as other people. It's also difficult to estimate the quantities and the nutrients and how much intake we had of those nutrients, as we need to account for metabolism, for the amount of nutrients that were in those specific foods, and all of these factors can make it quite challenging. And even though we wish for tools that are valid, reliable, feasible, sensitive, inexpensive, and that don't alter the individual's diet, there are no assessments to date that have all of these characteristics. However, as you studied in Module 1, there are tools that have been validated and studied thoroughly that can help us do this nutritional assessment. And these are the 24-hour recall, the food records, the food frequency questionnaires, the biomarkers, both for the three-form concentration, recovery, or adherence, and then the anthropometric measurements and body composition assessments. So as a quick review from Module 1 and what you've learned before, let's go through the strengths and limitations of each of the methods. So when we talked about 24-hour recall, within the strengths we have that respondents can have the minimal literacy because we have a trained interviewer who has conducted the tool. It is less likely that the person changes their dietary behavior because this is a retrospective method. And then there is minimal burden because it's a short tool. Within the limitations, we do require a trained interviewer. There might be issues with estimating the portion size. Foods may be left out or without detail, and then it relies on memory for items and portions, so sometimes it can be inaccurate. But for food records, this is a perspective method, which is better. It doesn't require memory, and if the portions are weighted, then it can be more accurate. Within the limitations, there is a coding where the coding is labor intensive and it can be quite costly. There may be changes in the behavior because it's perspective. There is still literacy required. People need to know how to read and write. And then there is a high respondent burden, as this is at least done for 3 days. And there might be lower response rates and limits in generalizability. Now, the food frequency questionnaire represents the usual intake of the individuals in the population. It's self-administered, but it can also be done by an interviewer. Does not change a person's behaviors as it is retrospective, and it can be within 1 week, 1 month, or 1 year. It reduces time spent on coding and data entry because it is pre-code. It's used in large populational studies and is useful for ranking individuals on the nutritional intake. Now, for the limitations, it can be long and tedious depending on the amount of items that we have. The food list, we use food list rather than meals, which is not the total diet. It requires literacy if it's self-administered. It has recall bias, especially depending on the time span that we're looking at. food preparation methods are missed, and it can be developed for specific populations, but these specific food frequency questionnaires are not valid for other populations. And then we have biomarkers, which are the most objective measurements, which don't rely on memory or literacy, do not change on the individual's dietary behavior. It accounts for bioavailability and supplement use, and it's special for nutrients with high variability. The issues with this particular tool is that we can have measurement errors. They might not reflect the intake because of bioavailability or because of the endogenous production on a nutrient like vitamin D. It might not be available for some of the nutrients, just like fiber, might not be time integrated, might just record the last 24 hours and not a time span of 1 week or month or a year. It is very expensive and it can be difficult to obtain, especially in some populations such as children. And then finally, from an anthropometric standpoint, these are relatively non-invasive measurements. They are quick and easy, and they are cheap and require simple equipment, though it requires technical skills and someone trained. Cannot identify protein or micronutrient deficiencies. They cannot identify the small changes in the proportion of fat and lean mass, and we need more than one measurement to actually assess the nutritional status. All right, so let's wrap up what we just learned in Module 5.1. So first, remember that nutrition is a complex concept that is linked to behavioral, environmental, social, and biological factors, and that when we compromise one of these factors, our nutritional intake, our diet, and eventually our health can be affected. Then that nutritional surveillance and balanced nutrition and our diet in general is essential throughout our lifespan, and that we can have short and long-term effects, and that there are deficiencies and excess that could have specific implications in each of the age groups. Now, the epidemiological data, treatments, and interventions, as well as the political decision-making, must be supported by scientific evidence. And please don't forget this one. And then the nutrition research can provide economic and social benefits to individuals, to the communities, and to the nations. Also, just remember that there are multiple priorities in nutrition research, but particularly for Laos, let's keep studying malnutrition, micronutrient deficiencies, the uprising in chronic diseases, maternal and childhood, food security, access to healthy environments, and sustainable agriculture to improve the population's health. And even though there are multiple limitations that can affect nutrition research, rather than focusing on that, let's focus on all the factors and things that we can do to improve nutrition research for not just our individuals, but our populations. Finally, nutrition epidemiology examines the effect of diet and nutrition on population's health over the life course using epidemiologic and statistical approaches, as we're going to study later in this module. And remember that nutritional assessment is fundamental in nutritional epidemiology, and even though there are no perfect tools to measure our diet or to measure our nutritional status, there are current methods that help us understand the effects of diet on human health, but we always need to account for the strengths and limitations when we are conducting our research. We hope you had a great time in this module. Thank you for your time, and if you have any questions, just let us know.